Welcome. In this video, we'll walk through key coding steps for radiology X-ray services, covering CPT codes, imaging views, ICD-10 tips, and common pitfalls to avoid. Let's get started. Let's review the CPT code used to report this service, 77072 Bone Age Study. This code represents a radiologic assessment of skeletal maturity using the left hand. Although the term study suggests multiple views, this exam includes a single AP anteroposterior view of the left hand, which captures the wrist and distal radius and ulna. The image is then analyzed using an atlas, most commonly the Greulich Pyle standards, to determine bone age. Per NCCI Policy H.11, you may not bill separately for individual hand or wrist X-rays performed as part of a bone age study. Single AP view of the left hand and wrist. This one image is used to evaluate growth plates of the phalanges, metacarpals, carpals, distal radius and ulna, skeletal maturation stage. No modifier left is required because left-hand imaging is standardized for bone age studies. Exam, hand bone age, frontal view of the left hand for bone age, history. Evaluate bone age, comparison, none available. Findings. According to the standards of Greulich and Pyle, the patient's bone age is 11 years, chronologic age, 12 years 5 months, discrepancy, 17-month delay in skeletal development, impression, normal skeletal maturation for age. Now let's choose the appropriate diagnosis code based on the clinical history and chart findings. Understanding bone age variance and normal limits. Bone age versus chronological age. In this report, the patient's chronological age is 12 years 5 months. The bone age, determined by comparison with the Greulich and Pyle Atlas, is 11 years. This results in a 17-month delay between chronological and skeletal age. But here's the key. This does not automatically indicate abnormal growth. What are standard deviations? A standard deviation, SD, is a statistical measurement that shows how much variation exists from the average, mean. In pediatric bone age assessments, SDs help determine whether skeletal development is normal for a given age. For children around age 12, one standard deviation in bone age is approximately plus or minus 11.94 months. Most children fall within 2 standard deviations of the average. If a child's bone age is within plus or minus 2 SDs of their chronological age, they are considered to have normal skeletal development, even if their bone age is behind or ahead by over a year. In this case, 17 months delay, less than 23.88 months, is still normal. This follows standard statistical interpretation used in pediatric growth assessment. Radiology report history states, evaluate bone age. While this is a valid reason to order the test, this vague phrase is often insufficient for medical necessity on claim submission. What should the coder do? Check the chart. Look for a more specific clinical reason. Is the child being evaluated for short stature? Is there concern for precocious puberty or delayed puberty? Is this tied to a known endocrine disorder such as congenital adrenal hyperplasia? Is the ordering doctor monitoring growth hormone therapy or predicting adult height? Only with this context can you select the most accurate ICD-10 code. In this case, because the radiologist determined skeletal development to be normal and no clinical concern was specified, the best match, until proven otherwise, is Z00.129, encounter for a routine child health examination without abnormal findings. Correct codes for this chart are CPT code 77072, Bone Age Study, ICD-10 CM code 00.129, Routine Child Health Exam without abnormal findings. Thanks for watching. Be sure to check the links in the description for helpful resources and subscribe for more radiology coding content. CPT is a registered trademark of the American Medical Association, AMA. CPT codes are used in this video for educational purposes only and do not reproduce CPT descriptors in full. This video is not a substitute for the AMA CPT Professional Edition or official coding guidelines. Verify all codes with the most current CPT code set and payer policies before claim submission.